is patient-centered care?
Patient-centered care is the application of caring for patients that is respectful of patients' preferences and values. This includes other healthcare professionals collaborating together and deliver coordinated care to the individual, provide information of their medications and educate them, as well as ensuring they get the support and comfort of their expressed needs effectively. With that, it will also empower patients to adhere to their medications, leading to successful health treatment. However, how do we provide patient-centered care to the visually impaired? The first step would be identifying them. Visually impaired patients have an added need of care but should not be treated with prejudice. A person who has complete vision loss will use a white cane or be accompanied by a guide dog or helper. Some blind people may need help with almost every transaction within the pharmacy. However, everybody has individual needs. Always ask how you may assist. There are several ways we could assist blind patients. For example, you could help them walk in through the entrance of the pharmacy and guide them to finding an available service counter. Other ways of assisting the blind could include identifying the item or service which they require and helping them with the payment. Once the payment is done, you could guide them towards the exit of the pharmacy. People who are blind are more capable of recognizing and accepting their disability and do not hesitate in seeking help from others. In contrast to this, people with a partial loss in vision may not be aware of their condition and could deny their impairment. These people are often more difficult for pharmacists and pharmacy staff to identify. Clues to look for are medication for treatment for ocular condition, especially eye drops, lack of confidence in negotiating the pharmacy, difficulty identifying coins and notes when making payment, inability to read or follow written directions, holding items very close to the eyes.
The following scenarios will show you how to provide patient-centered care to regular patients and patients who are visually impaired.
Kate is a 36-year-old woman who is hypertensive and a diabetic. She has come to your pharmacy with a prescription for metformin and perindopril. Your pharmacy happens to be understaffed today since it is a public holiday and it's lunchtime. How do you make sure that this patient receives appropriate counseling?
Hey, how are you doing? I'm Karen. I'll be your pharmacist for today. How can I help you?
Hi, could you please fill in this prescription for me?
Sure, Miss Kate. Is this medication for yourself?
Yes, it is.
Have you been taking this before?
I have been taking medications to control my blood pressure, but the doctor tells me that I have diabetes, unfortunately.
Sorry to hear that.
You ask her questions about her medication history, and if she is taking any other medications, you confirm that she is currently not on any other prescription medications, over-the-counter and complementary medicines. She is also not allergic to anything. You ask her a few questions about her diet and lifestyle, and learn that she eats a lot of takeaway foods, but everything else seems fine. She seems concerned about diabetes because she doesn't like taking medications. As a pharmacist, how will you deliver important information to her and make sure she adheres to her medications? You counsel her on how to take perindopril even though she has been taking it already. You advise her to take metformin twice a day with her food and notify her of a few side effects that she may experience. You also give her lifestyle advice on diet and exercise, and stress on the importance of regular checkups with her doctor.
That would be an example of good patient-centered care for someone with diabetes and hypertension. But what if this patient was suffering from partial visual impairment such as glaucoma and had the same conditions? How would you, as a pharmacist, convey the same information and ensure that she is able to read her label appropriately? The same patient walks into your pharmacy, but in this scenario, she is suffering from glaucoma apart from diabetes and hypertension. Your pharmacy assistant notices that she looks confused and has some trouble navigating her way to the counter. You walk up to her and ask her if she requires any assistance, to which she agrees. She hands you a prescription for metformin, perindopril, and a repeat prescription for travoprost. You ask her the same questions about her medical history, allergies, if she's taking any other medications at the moment, and about her lifestyle and diet. She tells you that she was diagnosed with glaucoma 8 years ago and that a recent field test has shown progression of glaucoma. She also tells you that she has trouble reading and usually does not step out during the day. You also learn that she forgets to take her glaucoma medication sometimes. The counseling for this patient for her diabetes and hypertension will be the same. However, you must demonstrate her the right technique to instill her eye drops. You also urge the importance of taking her medications regularly as her condition has worsened due to her not adhering to the medications. Because she has trouble reading, you can print out the labels in a large font. You would avoid handwriting the labels since it would be difficult for her to read it. You also provide her with a self-care card because she has problems with adhering to her medication. Important points for self-management on the self-care card could be highlighted to make it more visible to her and easier to read. It would be helpful to stress on regular follow-ups with her doctor to check the progression of her glaucoma every 6 months. In this way, you would have appropriately counseled the patient regarding her medications, improved her compliance by printing the label in a larger font, and advised the patient to follow up regularly.
But what if the same patient happens to be completely blind? How would you employ patient-centered care for her in this case? This problem can be easily overcome and will be shown in the next scenario. Kate walks into your pharmacy with a guide dog. It is evident that she is blind. You ask if you could assist and guide her to the counter. You got her a seat and make sure she is comfortable. She hands you over the prescription for metformin and perindopril. After asking her all the relevant questions, she tells you that an accident a few years ago caused her to become blind. She often finds trouble with taking her medications because she cannot distinguish between the tablets. Because of this, she's not able to adhere to her medications. How would you as a pharmacist improve this patient's compliance? You could advise her to use a Braille pill box. It has tactile markers for days of the week and the pills could be kept inside the pocket so that she can take her medications without worrying. You assist her with adding the medications into the pill pockets for 1 week. You also make sure that she fills the tablets by hand so that she can be familiarized with it. You urge her to mark the container with different number of rubber bands to distinguish medications with similar shapes. If she has troubles with doing this, you encourage her to seek help from family or visit a pharmacy again.
To summarize what we have learned so far, we consider how we can identify different types of impaired vision and also encounter different situations which include a regular patient and a visually compromised patient. As previously mentioned, partially and completely blinded patients do require extra care. It is important that pharmacists should make a comfortable environment for the visually impaired patients in the pharmacy. For a partially visually impaired patient, the pharmacist should avoid handwritten instructions as it can confuse the patient. Other ways to help the patient is to print out a larger copy of a label and to use a brightly colored marker. Keeping in an enlarged magnifier would be useful for the patient to identify the medication and read instructions. For a completely blind patient, more attention is needed, which includes using a Braille pill box so that the patient can recognize the raised lettering on the compartments. Or put different drugs into different sized or shaped containers, which can help the patient differentiate between them quickly and easily. Additionally, similar shaped drops can be identified by marking the container with different numbers of rubber bands so patients can distinguish between the drugs. The obstacles of providing a patient-centered care for the visually impaired can be easily overcome by being aware and tailoring their needs to bring about a personalized care for them. It's all about getting the right care at the right place at the right time.